So the first thing you want to do when setting the mandibular anteriors is you want to look in two dimensions first. You want to make sure they have the correct angulation anterior posteriorly, and then the actual midline dimension. So you want to make sure that they line up with the midline, and a lot of times it can be hard to see because of this bar, but if you close one eye you can kind of eyeball it. The other thing is that I want to make sure that I have a nice, gap right here. Just enough of a space in here. And lastly, once you feel pretty comfortable with that, obviously you're always fine-tuning stuff, but make sure these are undone, and then we want to check protrusive. So we push it back a little bit, and we want to make sure these teeth to touch in protrusive. So what I'll do is I'll take it into protrusive, and then this also helps with the midline a little bit. I make sure that the teeth are lined up correctly. They're mesial distal axial inclination, and I push them up also into the correct position. So you want it to be just right, because if they're too high, these incisal edges tend to catch, and then you'll get something like that where it'll push it forward. So, and if it's too low, obviously they don't touch, and then you don't have the protrusive contact. So sometimes it takes, not sometimes, all the time, it takes a little bit of toying with to get it just in the right position to where they'll touch, but coming back, if you make too far of a protrusive movement and you come back, you don't want it to knock that tooth out. So basically get it just to where it's touching. And you want those two teeth to touch also, or you want the mandibular teeth to be in contact just like this one. So it takes a little bit of toying, but once you get it lined up in there and where you want it, then you're going to go ahead and lute them down.